My name is Daniel King. I'm Professor of Organisational Studies at Nottingham-Trent University.
My name's Emma Campbell. I'm a researcher at the University of Nottingham.
Hi, I'm Kim Thomas from the University of Nottingham.
My name is Andy Green. I am the Interim Director of the Nottingham Breast Cancer Research Centre, which is based at the University of Nottingham.
Hi, I'm Kerry Setchfield from the University of Nottingham.
We need to hear from them, so what their experience of eczema are.
So it can really vary how I want to engage with communities, but one of the key things is actually when we put out surveys and things, get community organisations to participate. We feed that sort of data through to the governments. It's really important to get community voices.
We want people to feel that they're able to have a voice and to bring that to our research. You want to make a difference to patients' lives, and making sure that the only way to do that is to be involving as many different people from as many different communities.
I think it's always challenging for university academic staff to engage with communities without a prior link. It's incredibly challenging to be able to approach communities for their advice and their support.
So more diverse communities, underserved communities. We do have representatives in our research, but not as much as other communities. And that's something we really need to address, but it's hard to say why. We know we're not reaching a lot of these communities, but it's really tricky, especially when you've got a limited budget and limited time. It's really difficult finding the most effective way to reach those communities. But also, even if you do reach them, there might be something we're not aware of as to why they don't want to get involved.
I know that trust can be an issue for some communities.
Quite often there's a lot of suspicion and uncertainty within those communities about what it means and what we're trying to do as researchers. So building trust and trying to break down some of those barriers can be quite a time-consuming thing, but if you get it right, it can be really rewarding as well.
But just really try and meet them on their own ground where they feel comfortable to talk to you.
Trust, building understanding.
Really just making people understand that research really is for everyone.
We certainly feel it beneficial working with our local communities, especially those in underrepresented groups.
So I think it's understanding what happens to your personal data.
Listening to those communities and understanding what are the sort of challenges they're facing.
Communities can help to shape the research question.
So there's no point in trying to encourage people to get involved and not listening to what they're saying. So it's about that just being down to earth, being realistic and listening and making sure that it's a two-way process, not just take.
So I think we all have a inherent interest in what research is being conducted.
Through this project, I've been amazed at how many different ways people have told me that they've got some value from being involved.
I think research is great to be part of.
Anything that you might need for your healthcare in life has to go through research first.
But also understand that the researchers are often under quite a lot of pressure to get things done as well.
The South Asian community has a very strong family influence. So if one trusts you, they all trust you.
Our community is reserved about certain areas of health, and they prefer to keep it private.
That there's a big gap between like the older and younger generations.
Researchers should know about community values.
Our community is very diverse. Language, culture, beliefs differ. So do awareness and interest in research.
Day-to-day struggles and cultural differences.
About the community norms. The researcher need to understand the gender differences.
Work with people the community already trusts.
If we see people who look like us, we are more likely to trust it.
I think be transparent and involve, as I said, community leaders so to gain that trust.
Collaborate with researchers from our own community.
Yeah, the researcher must have to attend the events and the gathering of that community
Perhaps working in our community itself to avoid technical terms. Also, digital footprint is a really big thing for the younger generation.
Be open and transparent. That helps build the trust.
Research should be available in different languages which people understand and can relate to.
Seeing real changes and benefits in community would definitely encourage participation.
Yes, it will encourage me if the outcome of the research be followed by the health services.
I think people will join or think of joining if they understand clearly the purpose of the research.
By seeing the improvement in the health sector, I can become a connect with the community and the researchers.
I'd be willing to act as a bridge between the researchers and our community.
I'm also an RJ on the radio, so anybody that wishes to come onto my show and talk about health care research, they're more than welcome to do.
I want to be part of the whole journey.
Being more involved in surveys, questionnaires, and giving feedback.
Giving my views to the researchers.
I feel like the A&E is very disturbed in this sector.
Things are improving with the NHS.
My experience over the last 15 years has been very mixed.
I made an appointment. It was easy to make the appointment.
Very bad one.
I think with health services, it's something which is touch and go. Sometimes it's very good and sometimes it can be poorly.
I always had a very good experience with hospitals, but the GP is hard to reach.
Where I do find difficulty is making an appointment with the doctor.
It depends on how the health professional listens and reacts to what I say.
When you push them, then you can get to your goal.
I believe it is, yes. Yeah.
No.
When you reach at the hospital, somehow you will get your chance to be heard.
Be more approachable.
Engaging communities takes time, but once trust is built, they will stand with you throughout the journey.
That if it's not on social media, we probably won't see it.
Don't give up. Keep carrying on researching. One day the health services will listen to it.
I think they should work with us and not on us.
Try to connect with the community through different ways.
It will be beneficial for the next generation.
This is your chance for your voice to be heard.
We shouldn't be afraid to speak up our mind.
If we want the right treatment, it must be based on right data.
Take part. It's for us.
This research is for our benefit. It's for benefit of our children, our grandchildren, and their children's children.
Provide culturally sensitive care.
By understanding the background of our community from the country they came.
Quick response and timely support.
Hiring more staff.
Work on improving it more for the older generations.
Make more hospitals to cover the backlog.